You're watching The Wellness Hour, leader in medical news information. I'm Randy Alvarez. Today's topic, reversing type 2 diabetes. With us, we have Dr. Ott. Dr. Ott, welcome to the program.
Thanks so much.
All right.
Great to be here.
Now, before we get into the specifics, I got a lot of questions about diabetes. Tell me a little bit about your center, because you do more than just diabetes.
Correct. We have an integrative center where we have professionals really from all different fields, so physicians that work together, and we work really with three specific conditions. Diabetes, first of all, type 2 diabetes to be specific, thyroid problems, hypothyroidism, as well as neuropathy. Peripheral neuropathy is another condition.
Okay, and now you have centers scattered across
Correct.
the country, is that right?
Yes.
So you are Integrative Health of Orlando.
Yes.
And so good, good for you. Now, diabetes, type 2 diabetes. You say that you see reversals in type 2 diabetes every week?
Daily.
Daily in your practice?
Daily. Yeah.
Is that right?
We watch patients on a daily basis start the process of either turning the disease around and improving on it, or completely being non-diabetic.
Okay. Now, I talked to one of your partners, and she believes that you have one of the most comprehensive type 2 diabetes treatment programs in the country. Do you believe that? Do you feel that way?
I think that we do. I think that we approach this disease really from a standpoint of recognizing that it has to be individualized. Every patient has to be treated like an individual. And because of that, I think we uncover things that have been ignored, missed, and it allows us to get results I think that our patients are enjoying and that people are talking about.
Okay, so diabetes, how big of a problem is it, by the way?
It's epidemic.
Okay.
I mean, it's probably the plague of this country right now. It's the thing that
Kids are getting type 2 diabetes now?
At unheard of rates, right? I mean, we have children now who are 7 years old being diagnosed as type 2 diabetics.
Used to be adult onset.
Correct.
Diabetes.
You'll notice that term is not used at all anymore because it's no longer applicable. I mean, there's not a case, or it's not the case, I should say, anymore, where type 2 diabetes is adult onset. It's type 2 diabetes, and it could be as young as 5, 6, 7 years old.
And so, I researched, limited research on this topic before you got here, and there's books on, mainstream medical doctors that believe it's 100% reversible. So
Right.
You share that thought too, that belief.
Absolutely, yeah.
That type 2 diabetes can be reversed.
Type 2 diabetes is a reversible condition. There's no doubt about it.
Without medication.
Yes. The scientific literature on that alone is astounding. The studies and research that have come out of numerous highly regarded universities in this country, huge study that just came out of France that showed diabetics who are on insulin getting off of their insulin and becoming non-diabetic in as little as 2 weeks. I mean, this is not something that's new to the scientific community. It hasn't made its way into mainstream, doctor on the quarter's office yet, but that doesn't mean that it's not well known out there in the literature.
What's the number one misconception about type 2 diabetes, adult onset diabetes, with the diabetics out there that are taking insulin that you hear?
Probably the number one is that once you have it for a lifetime.
That's not true, in your opinion?
It's not. Well, I mean, we just talked about it, right? We just said that diabetes is a reversible condition. Are there cases that are not reversible? Sure, right? There's no such thing as 100%. We'll be honest about that. But in the vast majority of cases, type 2 diabetes is absolutely reversible. And the biggest misconception that patients are told is that you have this disease, it's degenerative, it's going to be progressive, you're going to be stuck with it for the rest of your life, and the best that you can hope for is to manage it. Right? We're going to manage it as best we can to mitigate or minimize the occurrence of all the side effects of this disease progressing. But other than that, welcome to the diabetes show. You're stuck with it.
Okay, so there's different categories of diabetics that you treat. Okay, so you've got the pre-diabetics, right? Mm-hmm. You've got the diabetics that have been on, just started maybe insulin, and then you have those that have been on insulin for 20 years.
Right.
All those categories, are they all workable, all treatable?
Yes.
Even after 20 years?
Yeah, great example. Patient we treated, I think we finished up with him probably about 4 months ago, on insulin for 18 months, for 18 years, not 18 months, was taking an astounding number of units of insulin on a daily basis.
Okay.
After 18 years of insulin use daily, this patient was off of his insulin completely in 2 months.
Okay.
Off of it. In 6 months was completely non-diabetic, taking absolutely no medications. And on top, it wasn't just his medications for his diabetes, it was his medications for all the other things that had crept up over the 18 years. Well, heart disease, he was taking statin drugs for his cholesterol levels, right? Off of those, because his cholesterol balanced. The good cholesterol came up, the bad cholesterol went down, total cholesterol normalized, triglycerides got back into normal ranges because his blood sugar was balanced, got off of his blood pressure medications, lost a bunch of weight, right? Took that weight off the midsection, and blood pressure magically starts to fall. Okay, no need for the meds anymore.
So this guy that you're talking about, though, how does his life change specifically? I mean, how does he feel differently? What does he do?
So let me point something out specifically. This patient was in a place where after 18 years of insulin use, he was essentially a couch potato. He did nothing on a daily basis. Not only did he do nothing, he lived in fear constantly. He was worried.
Is that typical, by the way?
Yeah. They're worried about dying of heart attacks. They're worried about developing cancer. They're worried about these diseases that creep up on them over the years as a result of the diabetes progressing. So he was a person who was a prisoner to fear, lived on his couch because he had no energy to get up and interact with his family. I mean, his wife literally told me, I don't even know who this guy is anymore. Okay. This is not the man I married. So in as little as 6 months, he's back to the old guy that his wife knew. He's active again. He goes, we're in Orlando, so Disney World's all over the place, right?
Okay.
He's back at Disney with his grandkids.
One of the things we talked about in the green room, and I'm paraphrasing what I said, but it was like about what do you want to be known for? And you said results. I mean, without hesitation.
Right.
That your program's about results.
Right. Yeah, I mean, that's the bottom line, right? If you're not delivering results, then what's the point? So for us, it's all about that. It's about outcomes. It's about the patient coming in with a set of goals, and we want to determine those right from the outset. What is it you want to accomplish? What do you look? If the patient comes in and says, I want to scale Mount Everest in 4 months, we're probably not going to accept you as a patient. I'll be honest. Okay. That's not a goal that's realistic or achievable. But when we have a set of goals that we believe are realistic and achievable, then we set out to actually achieve them, to meet those goals. Have the patient actually do the things that they want to actually achieve and get to.
Let's go right into your approach. Okay, so somebody has diabetes, watching this, their loved one has diabetes, type 2 diabetes. What's the traditional approach and what's your approach?
Traditionally, diabetes is looked at as, like I said earlier, a progressive degenerative disease. So patients, once they're diagnosed, which usually is in some roundabout way, patients usually find out it's like they get hit out of left field with it. Right? They go in for a routine physical, they go in for their annual visit with their doctor, routine blood work is run, blood work comes back, lo and behold, elevated blood glucose, right?
Okay.
You're type 2 diabetic. We got a problem. See you in 3 months, we'll follow up, and if things aren't looking any better, we're gonna have to have a discussion about that, right? 3 months later, they show up, blood sugar's still not well controlled or maybe is worse. The discussion happens, oral medications enter the picture.
So like an oral insulin?
Not oral insulin, but other medications that help with suppressing blood sugar or help the pancreas produce even more insulin, for example. Sort of supplant or not supplant, but raise those insulin levels up even higher. So those meds have all kinds of side effects, and people who are taking them know that these side effects are there. And they're everything from cancer is a well-known side effect of long-term use of these drugs, as well as insulin, weight gain. Fatigue, all kinds of different things that these patients start to deal with in their lifestyle.
Okay, so if they take the oral medication, that doesn't work, they still have blood sugar problems, then what? Then the insulin?
More is the answer.
Okay.
So, patients will start off with one oral medication, which the dosage creeps up over time. And once they get to a maximum dose of that medication, they layer on usually another. And it's not uncommon for us to see, patients who come in who are taking 3 or 4 different oral medications for their diabetes, and then insulin gets.
And by the way, so before insulin comes along, they do all these oral medications. Is that where you like to see these people, like early on?
Preferably, that would be wonderful.
And is that the easiest to turn around? I mean, if you had to say, really?
Absolutely. Yeah. Before we get into insulin, it is always the best place to get.
Okay, so now they're on insulin.
Right.
And what are they told, by the way?
They're told you're going to be on insulin for the rest of your life.
You smirk almost when you say that.
Yeah.
You don't. You think that's ridiculous, by the way, for lack of a better term, I guess?
In a type 2 diabetic scenario, in most cases, yeah, I do. Because I know it not to be the case. I know that it doesn't have to be that way.
So it's not an insulin problem because they're giving insulin. Obviously, they think it's an insulin problem, not enough insulin.
Right. Yeah.
Isn't that the problem, though?
The problem is none of the research agrees.
Okay,
right?
but isn't that the problem though? Not enough insulin?
No, it's not. I mean, as bluntly as I can put it, no, it's not the problem at all.
Okay.
Insulin is not the issue. The issue is insulin resistance. The issue for this patient is in most type 2 diabetics, the problem has nothing to do with how much insulin is circulating in the system. In fact, they have more insulin circulating in their system than the normal healthy non-diabetic person does.
Is that right? Okay.
The problem boils down to their cells don't respond to insulin. They're resistant to it. So here's the analogy I give patients. Look, you have a door on the cell, and that door's job is to open or close to allow blood sugar into the cell or not.
Okay.
Insulin's job is essentially to unlock that door. In an insulin-resistant diabetic's case, what happens is insulin comes along, sort of pounds on the door, nobody's home, and moves along.
Okay.
And it's not until you have insulin and 10 of his insulin buddies that pound on the door that the door
which
finally...
would be the medication insulin. Which
exactly.
Is taking insulin. Okay.
Right. Until finally the door, basically just gets shoved in and it allows sugar to go in. But over time, what happens is the cell becomes more and more and more and more resistant to it. And so you need higher and higher and higher levels of insulin to get the same effect. So insulin resistance is the culprit. And if you understand that from the outset, then it completely changes the treatment paradigm. Because now you're no longer dealing with a pancreas that's not producing enough insulin. You're dealing with a body that's not responding to the hormone that it should. And so you have to address it from that way.
And the medical community is mixed on this. Knowing you're coming on, I'm talking to medical doctors that are saying, I 100% agree, because I talked to you guys on the phone about this. 100% agree. You could take people off insulin. It's with nutrition, with the right kind of testing, identifying the triggers, as you call it. And then there are other medical doctors, it's like unheard of. They say, no, impossible. Right. I mean, literally, I heard impossible.
Yeah. Well, it's
but how could they say that then?
Look, people's realities are their daily experiences, aren't they?
So if they don't see it?
So, I mean, if your practice is made up of 40 visits a day of people who come in and progressively get worse with time, none of them get off of it.
Okay.
And, all they see is visit after visit, insulin needing to be raised in order to control blood sugar, then ask that person if it's possible. They would tell you no. Why? Well, they don't see it. They never see that.
Okay.
Right? But you can't tell me that because I see it daily. I see patients come in taking 80 units and in a matter of a few weeks taking 50.
And then in a few weeks after that?
Maybe off of it altogether or maybe down to 30. Each patient responds differently. We have patients as quickly as in a couple of weeks are able to have their medications phased out because things are under control, and others that can take 6-8 weeks. But 6 to 8 weeks isn't really a long time for someone.
You guys do a lot of testing.
Yes.
That's the not conventional testing that a type 2 diabetic would normally get.
Is that
fair to say?
Yeah, you're giving up my secret.
Okay.
Right? You're giving away the secret. That's the key.
Okay.
The key is testing. If you're going to treat diabetics in an effective way, you're going to have to understand and know what's going on with them.
Okay.
Right? No more like, you're a diabetic, your blood sugar is high, so here, just take this, we'll suppress the symptom. Look, these drugs are aimed at controlling symptoms. They're suppressive in nature, right?
Right.
Push the blood sugar down. That's the point of them.
So what's the answer then? The
answer is find out why the blood sugar is not regulated properly. Remember we said earlier, diseases are really a matter of imbalances, right? Diabetes is no different. It's an imbalance.
So go to the cause.
Right. We have biochemistry that's
And is it easy to find the cause, though?
I wouldn't say it's easy, but it can be found with some diligence
Most
and some
of the
work.
time, it's what, in your opinion?
80% of the time, I'd say it's adrenal dysfunction. That's what we see clinically.
Caused by what they eat?
Can be caused by their stresses. Some of that could be what they eat.
Okay.
Environmental stuff, stress, lack of exercise, lack of sleep. So it could be a number of different things that are pushing the adrenals to either underproduce or overproduce. Whichever it is, we need to understand which one of those it is. And then there's other factors involved as well. Thyroid function, the digestive tract and how it's functioning, the liver and its function. All of these things have regulatory effects on blood sugar. And so if we're going to get blood sugar balanced, we're going to have a system that's balanced.
Okay.
And that's how we approach it. Find where the imbalances are, do the testing that's appropriate to do so.
Give me an example of some of the testing you do.
Well, just for adrenals, for example, because it's such a primary culprit, we see it so frequently be the primary cause, and even when it's not a primary, it's in the picture at least. We want to test the adrenals. We want to know, what are the adrenals doing? Throughout an entire day,
But how could the adrenals have anything to do with type 2 diabetes? Help me understand that part.
Right. Real simple. The adrenals produce two very, very powerful hormones for the body. One of them is cortisol, which most people have heard.
These are stress hormones, right?
Right.
Okay.
Cortisol is akin to the drug that people are most probably aware of, which is cortisone. All right. It's the precursor. It's your body's natural cortisone, essentially. So cortisol is one, and epinephrine or adrenaline is the other. Both of these compounds have very, very powerful effects on blood sugar and how it's regulated. Look, any type 2 diabetic who's been diabetic for any amount of time knows they can't take cortisone, the drug. Doctors don't prescribe it to them, because if they do, what happens is their blood sugar goes through the roof, right? That's the effect that cortisone has. Well, if you have adrenals pumping cortisol out in endless quantities constantly due to stress responses, what do you imagine happens to blood sugar?
Goes up.
Yeah, absolutely, right? That's what cortisol does.
So take care of the adrenals.
Yes.
That's one big focus of what you're doing. What else? What else are you doing?
Digestive function. American digestive function is about as bad as you could possibly imagine it could be. So, with the gut, the problem becomes an issue of either absorbing things that it shouldn't absorb, all right, known as leaky gut syndrome. I don't want to get all technical.
This is the intestines we're talking about?
Correct.
The intestinal tract? Okay.
Yes.
So you help them with their digestion?
Yes.
Okay.
Yeah, because it's a big trigger. Look, most of our life is lived through what we take in, how we assimilate it, and what our body does with it, right?
Okay.
Well, if that's foundational, if that system's not working properly, if you're pulling things in that you shouldn't, right? Or if you're not even giving the system things that it needs, right? Dietary, just as a baseline, then those things are gonna have to be addressed. They're causative. We gotta look at cause. It's about getting to the root, right? If you dig the root out, you can fix the issue.
But you have a 4 to 6 month program.
Generally.
Type 2 diabetes, and people that are watching, we're talking about reversing type 2 diabetes, but you see reversals if the patient's compliant.
Yes.
You see reversals on these patients off their meds, off their insulin.
Yes.
It's typical. So I don't have to put its results aren't typical. I mean, it's typical. Is that fair? Is that real?
That's the typical effect of doing the right things.
Okay.
So when patients are able to comply, right? Well, patients come in, the first thing is motivational fit, right?
And you guys have a free consultation. I should mention that too. Is that right? Where they can come in and find out if...
Yeah, and I'll be honest, that consultation is as much for us as it is for the patient.
Okay.
It's as much for us to know whether or not that patient's going to be a fit for what we do. Because if you come in unmotivated, like, I want to get better, but I want to keep eating Twinkies too.
All right.
Well, those are two things that don't go together, right?
Is that one of the reasons why you think they like the medications? Because they don't have to change any
for
diet
some
or
people
anything else?
Yeah, I think initially it's easier, right? It requires less lifestyle.
Do you think they don't
impact.
believe it though, by the way? Maybe they would eat better, but they don't believe that could have any impact on this?
Well, here's the thing. Okay. Once things are biochemically as out of balance as they become over the years with diabetes, what these people actually start finding is that their blood sugar is not balanced no matter what they eat.
Okay.
In many cases. The biochemistry is so off that even when they put the right things in, right, we don't get a good response. Or they're eating foods that are so-called diabetic friendly, but their systems don't like them, right? Food intolerances, for example, food allergies, things of that nature.
So you're looking at food allergies?
They can be a huge role.
You're testing for food allergies?
Absolutely.
Interesting.
If it's necessary, we do. Patients come in, here's a great example. Patient came in, we've been treating this patient, they're actually currently treating with us. Been treating them for about 4 weeks. They're eating all the right things, so to speak. But we start seeing like this spike happening on certain days. So we start looking back at their food diaries and we notice every time they eat tomatoes, their blood sugar jumps. Well, look, you ask anyone out there if tomatoes are a non-diabetic or a diabetic unfriendly food, they tell you no way, right?
Okay. You
can eat tomatoes if you're diabetic. Not a big deal.
Yeah.
Problem is for this patient, it's a big deal.
Why?
Because their system's responding to it in a way where it's mounting an immune response to it. It literally sees that tomato as like a foreign invader.
So like it's allergy. So it picks up as a tomato allergy.
So remember, back to cortisol, right?
Okay.
What happens when an allergic response kicks in?
What?
Inflammation, right?
Okay.
There's inflammation in the system. As a result of that, your body's response to inflammation is cortisol. It's the natural anti-inflammatory. That's your body's anti-inflammatory compound.
Which will raise blood sugar as well.
You got it.
Okay.
You're tracking with me now.
Do some patients want to know the science behind it and others just say, look, I just want to get better?
Yeah, some do. right? Some patients are really analytical and some,
you guys will offer
and
that
some
as
don't
well.
care. Sure, yeah, I don't have any problem
And
explaining.
there's science behind everything you're saying. You're talking about food sensitivities, food allergies can interfere with diabetes.
Absolutely everything that we do in the office is backed by research and clinical science.
Okay, good. We're going to take a quick break. Back more about what to expect on day one. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about type 2 diabetes and how to reverse it. We'll be right back. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're discussing type 2 diabetes and how to reverse it. With us, we have Dr. Ott. He runs one of the most comprehensive centers in the country for type 2 diabetes, at least according to him. And I want to welcome you to the program.
According to you.
According to me, that's right. Well, I said it, but you, I mean, look, behind the scenes, as far as the way you're attacking type 2 diabetes, it's about as comprehensive as what's available out there.
We're using the cutting edge tools that are available today.
Okay, good. Now, so somebody watching this type 2 diabetes, as a recap, you see reversals in type 2 diabetes daily in your practice.
Yeah.
And you say everything you do is backed up by science, but you attack diabetes a little bit differently.
Yes.
Give me a quick recap for people that weren't watching the first part.
It's about getting to the root of the problem versus suppressing the symptom. I mean, that's really the easiest way to describe what we do. So what we do is we identify the triggers, eliminate the triggers, and then support the body.
Triggers, when you say triggers, what do you mean?
Anything from a patient being overstressed.
I mean things that could trigger blood sugar going up.
Correct.
Okay.
So stress can be caused by a number of things, right? Emotional stress is what everyone, of course, defaults to when you say that word stress. But look, if you have a latent infection in your body, if you got an infection in the bowel or in the digestive tract that's latent, no outward signs of it, it drives an inflammatory process. That stressor will continually affect your blood sugar. Got to know if that stuff's there.
Is that right?
Absolutely. So we look for those things. It's investigative work. You know, good doctoring boils down to listening to what's going on with the patient, educating the patient, and then doing the investigative work that's necessary to arrive at an appropriate diagnosis so that you can get an appropriate treatment plan in place.
Okay.
That's the whole point. This is why we see the results that we see in the office. We dig deep enough to find the actual problems, right? No cursory checkups. I don't want to see you in 3 months or 90 days. I want to see you next week.
Is that right? So they may see you once a week for how
long? Depending on the case, anywhere from 4 to 6 weeks to get things on track.
And supplements are involved?
Can be.
Are there a nutritionist within your practice?
Yes, we work heavily in the nutritional realm with these people. One of the biggest things we hear from patients all the time is, look, I got diagnosed. I went to this like 40-minute class, which I absorbed almost none of, right? One exposure to like, here's how you should eat for the rest of your life in 40 minutes. Good luck.
Okay.
So they come out of this thing literally feeling like, you know, a leaf in the wind. They don't know where to go. They don't know what to do. They don't know what information's right, what's wrong. Everything disagrees. They're without a rudder. And so our job with these people...
So it's ongoing weekly education, training.
It's ongoing. As long as we're treating you, we're teaching you.
So final message. Okay, so somebody's watching this and we're out of time. Final message to somebody that they feel lousy, they have these symptoms, they've been on insulin for 20 years, and you say that you've seen people get off of insulin.
Yeah.
What do you say? Where do they start?
Start by taking action. You get up and you do something about it. You know, I think that most of these diabetics are in a place where they've lost hope. They've been disappointed for so long and so many times that they've thrown the towel in. I tell them, pick the towel up. You got to take action. You got to do something. And call.
You say you don't like to use cure, but so once it's gone, all their symptoms are gone, they're feeling good, they don't have blood sugar spikes. I mean, you follow up with these people 6 months later.
Yeah.
I mean, is that considered cure, or they just don't have diabetes
It's
anymore?
considered non-diabetic, right?
Okay.
So, I mean, you can use the word cure if you want. I personally don't like the term.
But you're healing their body, right?
Right. We're getting their body to a place where it's back in balance again. And as a result, they're no longer diabetic.
So will it take them a while to damage it again if they...
Yeah, you can do the damage all over again if you want to go back to doing all the things that you did to get there in the first place.
Did they say it's easy, by the way?
Yeah. We hear that on a regular basis, and I think it's because of the way that we plan care for these patients. We give them a roadmap. They're no longer left to be that leaf in the wind. They get a clear, concise map to follow. daily, not just week to week, daily.
Do you get a lot of referrals, by the way?
Yes.
I mean, patients, obviously they're going to tell their friends about this.
Yeah, and they tend to kind of congregate, right? So their family members, their friends, who are people that they talk to about their disease all the time, end up in our clinic all the time.
Now, I know you have a thyroid program, you have a neuropathy program, and the diabetic program. Which one for you is the easiest patient? Or do you get the most kick from helping them? Diabetic?
Yeah.
And why?
It's the most straightforward road.
Really?
To wellness. Yeah, it's the most.
In fact, you guys said that. I said I want to interview you guys about thyroid and the other. Well, diabetes is easy. I'd love to talk about it. And going into this, I'm thinking that's the tougher one.
Yeah. Now it's the most direct road from where they are to where they want to be.
So you get a patient that's open-minded, committed, willing to look at the new science, the new medicine, and you can reverse it completely.
Well, they can reverse it. We'll just help them.
Okay, good. Well, I want to thank you for coming on the show. Very good. Then they can go to the website. They can meet some of these patients themselves and hear what they have to say.
And most importantly, call and come into the office because it all starts with
free consultation.
Consultation.
Good. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, you can visit our website at wellnesshour.com. Just put in diabetes. You can put in Dr. Ott. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.